So the liver cancer is one of the commonest cancers worldwide. It's the 8th commonest cancer and the 4th commonest cause of cancer deaths worldwide. The liver cancer usually occurs in patients with underlying liver disease. So patients with normal healthy livers, most of them don't get liver cancer. They can still get some group, but most of the 95% of the liver cancers occur in patients with underlying liver disease. The underlying liver disease, the common causes are alcoholic liver disease, hepatitis B related liver disease, hepatitis C related liver disease. These three groups are the most common causes. And also other rare causes of liver disease like hemochromatosis, Wilson's disease, cryptogenic liver cirrhosis. So all these types of liver disease, patients are actually prone for liver cancer. More than all these causes, now there's a big dominant cause called fatty liver and NAFLD. NAFLD means non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is an extremely common form of liver disease these days. It is basically a lifestyle related disease. Because of excess calorie intake and a sedentary lifestyle. The prevalence of non-alcoholic liver disease in the Indian population, in the urban population for example, is about 50 to 60%. That is, every 1 out of 2 has non-alcoholic fatty liver disease. And in these patients with non-alcoholic fatty liver disease, they can develop something called NASH, non-alcoholic steatohepatitis. And so these fatty liver disease patients and NASH patients can go on to develop liver cirrhosis and liver failure, but also liver cancer. So once upon a time, the alcohol, hepatitis B and hepatitis C were the leading causes of liver cancer worldwide, but now they've all been overtaken by this NASH. And because India is a big hotbed of NASH and metabolic syndrome. Metabolic syndrome means, again, because of the basically type 2 diabetes, hypertension at a young age, fatty liver, these are all a group of one syndrome called metabolic syndrome, high cholesterol, high triglycerides, along with these diabetes, hypertension and fatty liver disease, basically related to a genetic predisposition we have, as well as excess calorie intake with a sedentary lifestyle. So the burden of NASH is huge, and because of that, the incidence of liver cancer in India is also rapidly rising, and a day may not be far away in the next couple of decades when liver cancer may actually become the commonest cancer because of this big pandemic of NASH and fatty liver disease that is prevalent throughout the world and especially in India.